chronic childhood disease in general is skyrocketing in kids. At the moment, we have just a little over 1 in 2 kids diagnosed with some sort of chronic health concern. Autoimmunity in adults is also rapidly on the rise, and children seem to be mirroring that. I have middle schoolers with Hashimoto's thyroiditis, toddlers with juvenile arthritis, and infants with Crohn's disease. And we have this, really this epidemic of autoimmune encephalitis in children called PANS.
This is Doctor Talks.
Welcome, Elisa. I am so glad that you agreed to be part of the MS and Neuroimmune Summit. You have such insight and expertise. Now, what I'd like to have you do is introduce yourself and explain your area of expertise.
So I'm so honored to be here, Terry. So for our listeners, I am an integrative pediatrician and pediatric functional medicine expert. I've been doing this a long time, over 20 years now, and I integrate conventional pediatrics with several other healing modalities. Functional medicine is a core piece, but I also incorporate homeopathy, acupuncture, herbal medicine, essential oils into the practice. I love teaching parents and kids how to understand the foundations of health and to help them thrive for their lifetime.
Okay. Well, let's talk about children and autoimmunity. How common is this?
So unfortunately, we know that chronic childhood disease in general is skyrocketing in kids. At the moment, we have just a little over 1 in 2 kids diagnosed with some sort of chronic health concern. And it may range from chronic constipation and eczema to more, quote, serious concerns like autoimmunity. And that number, that 1 in 2 number, is rapidly increasing. Now, with autoimmunity, we don't have specific numbers. We know that autoimmunity in adults is also rapidly on the rise, and children seem to be mirroring that. I have middle schoolers with Hashimoto's thyroiditis, toddlers with juvenile arthritis, and infants with Crohn's disease. And we have this, really this epidemic of autoimmune encephalitis in children called PANS. And one of the findings that was really alarming to me, this was a study from last year looking at ANA levels. And for listeners, ANA, your anti-nuclear antibody, is a very non-specific autoimmune marker. And following the US overall, by different age groups, the researchers found that there was a significant increase in the number of people in general with a positive ANA biomarker. However, the age group who had the largest proportions of increase in a positive ANA were our teenagers from 12 to 19 years of age. So this is, I'm just looking at the numbers on my screen right now. They looked at the late 80s as a baseline. By the early 2000s, the rate of ANA in teenagers had doubled. And by 2012, the rate of positive ANA in teenagers had tripled. Now we're already 10 years from that. So our kids' genes haven't changed in the last 30, 40 years. And this is why this discussion in your summit is so important, because we have to understand what factors have changed and how do we reverse this trend, this alarming trend of an increase in autoimmunity in our kids.
And so everyone who's listening, those positive ANA, that comes years before the damage has accumulated to be severe enough to get a autoimmune diagnosis that will have neurologic or psychiatric symptoms, hence the neuroimmune component. And this is why I'm so glad we have you here. Now, what are some of the foundational issues? I'm thinking of Hippocrates, talking about the gut health and food. Do you want to have any comments about Hippocrates' perspectives there?
Yeah, absolutely. So when I think about the foundations of optimal health, and in particular the foundations of optimal immune health, and as I, think about how do we reverse this trend? How do we try to prevent autoimmunity if possible in our kids and chronic disease? There are three key areas of mastery for our kids and for our families, and that's your microbiome, your mitochondria, and your mindset. Those are the three M's that I focus on. And Hippocrates is credited with saying that all disease starts in the gut. We know that that is especially true for children, and especially when it comes to their immune system. The 70 to 100 trillion microbes in our gut microbiome, they set the foundation, they meaning our microbes, set the foundation for over 70% of our immune system. And for a child, an infant whose immune system is just developing and learning how to deal with all of the antigens in the world, the toxins in the world, foods in the world, their gut microbial composition informs their immune system how to respond. Do they categorize a certain food or a toxin as friend and let it by? Do they identify that antigen as a foe and create inflammation? And here's the thing, when our immune system identifies that antigen as foe, sometimes the immune system can act in the wrong way and it start attacking our own cells. And that's when we have autoimmunity. And we know that the gut and the gut microbiome is intimately linked with how this occurs. In fact, gut dysbiosis or an abnormal balance of bacteria, parasites, yeast, viruses in your gut microbiome can increase the risk of developing autoimmunity. And there's specific bacteria that I look at when I do functional stool analyses in children, especially when they have a personal or family history of autoimmunity that I don't want in their guts, especially bacteria like Klebsiella or Citrobacter or Proteus that have been specifically linked with certain autoimmune diseases.
So, what's the big stressors as to why this imbalanced microbiome can develop in our infants, toddlers, children, adolescents?
So there are many, many stressors, and just by virtue of living in our modern sort of ultra processed, ultra fast world, we have so many. What I've been telling patients are what we would consider microbiome mischief makers, and unfortunately, one of the key factors in setting the stage for your child's gut microbiome is as a mom your vaginal and your own gut microbiome when you're pregnant and when you deliver your baby. Now, we can't go back in time and change what's happened, but if you are going to have a baby, I would say that optimizing your gut microbiome before you conceive is one of the best ways you can start your baby off with a healthy gut microbiome from birth. But from the moment they're born, the biggest disruptor to our gut microbiome as children and even adults are antibiotics. And so we have to really understand how to use those antibiotics judiciously and understand that antibiotics wipe out not just the bad bacteria that we want to clear, but really, all the good bacteria. And certain antibiotics actually have a preference for killing some of the beneficial flora in your gut while preserving some of the more pathogenic or abnormal flora in your gut. And so, with that understanding, when our children and our teenagers are on antibiotics for not just ear infections, but chronic long term antibiotics for things like acne, we need to understand how to do that mop up. The other key factors in our modern world and how we're living are the ultra processed food with all of those FDA approved natural and artificial food additives that have been shown in the literature, many of them, especially this category of food additives called emulsifiers that directly can cause gut dysbiosis, can directly harm the gut lining and the gut barrier function and trigger leaky gut, and have been correlated with a significant rise in autoimmunity in various countries. So, and we can't forget one of our biggest toxins of all is our modern world's psychological stress, because psychological stress, that persistent, elevated levels of chronic psychological stress can directly change the gut microbes that want to live in our gut. And that balance of gut microbes also can affect how we manage our stress. So it becomes this, perpetual, this vicious cycle because we know that our gut microbes are responsible for making the vast majority of our neurotransmitters like serotonin. And so, which is our feel good kind of calming neurotransmitters. If we have an imbalanced gut, it leads to worsening symptoms of anxiety, depression. And when we have anxiety and depression, it leads to worsening gut dysbiosis.
I want to go back to the word emulsifier, and we're going to go back to some of the psychological stress. I don't know that people know what emulsifiers are and
Ah,
how they would find them in their food. Like, it's not going to show up as the word emulsifier on the food label.
it's true. It's true. So an emulsifier is, if you think about an emulsion, right? an emulsifier in a packaged food as a food additive is the ingredient that keeps that food together. So if you think about, you know, if you buy what was the ice cream I was looking at the other day? I think it was Breyers, right? If you look at ice cream, you don't want your ice cream when you open it up to be this goopy, soggy mess. You want to stay that nice ice cream shape. So certain food manufacturers will put in emulsifiers to keep that food together. Emulsifiers are also used in infant formulas, the ready to feed liquid infant formulas. They're found in,
Peanut butter.
protein bars, in peanut butters, right? They're not found in all, but and you will notice that the foods, for instance, your peanut butter that has the oil on top that you have to stir, that's because it doesn't have an emulsifier, right? But
Mhm.
you buy the Jiffy that is that perfect, creamy shape that has an emulsifier. But what will you see on the labels? And this is really important because emulsifiers are one of the most gut harming food additives. You will likely see mono or diglycerides. Okay, that's a very common emulsifier. You might see carrageenan. You might see guar gum, which may or may not be is not as bad as a monodiglycerides. Polysorbates also act as emulsifiers. So just being savvy, you can look up, actually, the FDA has a complete list of food additives that I actually put in my book so parents could see what is
Mhm.
going to be on the label. But you can look that up yourself. It's really important to be a savvy food label reader because there are foods, and I'm not going to say I never eat out of a package. This is the modern world, and we're busy getting breakfast ready, busy packing the kids' lunches. But when you buy packaged foods or jarred foods, you need to make sure that you're reading that label and making sure that it is as clean as possible, whole foods, really not having any of these gut disrupting food additives in them.
Would a simpler way to thinking about the food label be if it's a word I don't recognize immediately as food that my grandmother would have recognized as food, it's probably a new compound that is not so good for my microbes?
100%. If you can't pronounce it, if you have to
Your
Google,
grandmother wouldn't recognize it.
yeah, your grandmother wouldn't recognize it. If you have to Google what it does or what it is, that's not something that you want in your kids' bellies or in any of your family's bellies for that matter.
Okay, so that's a simple measure we could all use. Now let's get back to psychological stress. And I'm gonna hold up my phone as I talk, and I'm worried about the impact these phones are having on our microbiome. Do you wanna comment on that?
Yeah. Well, we know that, I mean, there's many things with this that are problematic. There is, for our kids who, at too young an age, really are, have access to phones, to constant, texting, social media. We know that that directly plays a role in negativity, in reduced esteem, lower ability to manage stress. In fact, a study just came out, and I believe they just asked teenagers to reduce their screen time by 1 hour, which most kids are spending 7, 8, 9 hours of screen time a day. Where on earth is that screen time? Well, think about what kids are not doing when they're on their screens. They're not exercising, they're not sleeping, they're not having family meals, which are so important for our health, having face-to-face interactions with their friends and with their community. And so just reducing that screen time can reduce psychological stress and significantly improve your sensation of well-being, which is so important when we have this crisis of mental health in our youth right now. And then we have the electromagnetic frequencies, the EMFs, which some people are more sensitive to than others, but we are electromagnetic. And it makes sense that when you have this EMF that's bathing you and bathing these developing cells in your kids' brains and in their guts and in their immune systems, that EMF can have a potentially profound impact on how their cells actually function and interact with the cells next to them and interact with the extracellular matrix around them. A lot of concerns with that. And I'm not saying that we need to, in fact, we can't get rid of this, right? I mean, this is how we text each other, "Hey, are you on Zoom? Let's get ready," right? But we need to, be smart about the exposures that our kids have, how early they have them, and understand what they're doing on their phones and how to reduce the negative impact that the phone can have for them.
Well, you and I could talk for hours about that, but I guess we should probably move on to mitochondria.
Yeah. Yeah. Well, so, mitochondria are, I mean, everyone who follows Dr. Walls knows that mitochondria are really, so important to optimize and support no matter what's going on with your health, but especially if you have an autoimmune, a neuroimmune, or a chronic concern. And this is really true for kids too. And it's an area that a lot of practitioners, even functional medicine practitioners who work with children, don't really look at closely enough. We know that mitochondrial dysfunction can be triggered by many, many different factors, including infections like Epstein-Barr. Even the SARS-CoV-2 virus can cause mitochondrial dysfunction. There are environmental toxins that are mitotoxic to really directly impacting the health of our mitochondria and our lifestyle factors. So, lack of sleep, being dehydrated, eating a standard American diet, all of those put stress on our mitochondria. And children with chronic conditions, especially kids with neurodevelopmental concerns and immune dysfunction, when I look from a lab standpoint, and also when I ask the questions from a clinical standpoint, virtually across the board, they have signs of mitochondrial dysfunction, which would be low muscle tone, sometimes fatigue, but it's mostly poor endurance. These kids can play soccer and run around on the field, but then they come home and crash. And parents know no more play dates, no more anything the rest of the day, which is not normal for kids. It shouldn't be. Many, many kids are on medications too, over the counter medications that we know are mitotoxic, like, Tylenol or your NSAIDs can be
Okay,
stressful.
wait a minute. Tylenol, mitotoxic? So the drug that we're thinking is okay to give our kids for their aches and pains or after a vaccine is a problem?
Yeah, this is hugely important for parents to know. There are a couple of reasons. I mean, Tylenol, acetaminophen. I mean, what's the first thing that most parents and actually nurses and doctors reach for when kids have a fever? It's a Tylenol without even looking at the kid. In the emergency room, the triage nurse will reach for the Tylenol if your kid has a fever. But we want to first of all step back and understand the actual benefits of fever and fighting infections. But when we reach for that Tylenol can be directly mitotoxic. It also does a very important thing that we need to understand. It depletes our levels of glutathione, which is our master antioxidant. Now, when we are sick or when we have pain or when we have inflammation, our mitochondria become stressed. I mean, that's the normal way of things. And they create free radicals and produce something called oxidative stress. When we have oxidative stress, we need antioxidants to quickly mop up those free radicals so that we can heal, recover, and stay well. Tylenol, by depleting glutathione, our master antioxidant, directly impedes our ability to reduce that oxidative stress and restore mitochondrial function. So this is really important for parents to understand. There are options, from an integrative natural standpoint when your kids have fever, when your kids have pain, and if your kids do need the Tylenol, or that's the option that you have, make sure that you are supporting your child's glutathione levels with Epsom salt baths, cruciferous vegetables. Make sure you're supporting their mitochondria during those times. And please, when your kids are getting vaccines, do not give them Tylenol at the same time. Right? Tylenol is going to impede your child's ability to
Okay,
recover.
let's stop and repeat that one more time because I think that's a super important message. Slowly, carefully.
So yes, please, when your children are getting vaccines, please do not give acetaminophen or Tylenol concurrently. If your child needs, a fever reducer or pain management, if they've gotten the tetanus and their arm is really sore, ibuprofen would be a better choice at those times. However, oftentimes we can do a cool bath, we can do a cool compress, we can maybe try some homeopathics or essential oils and not need to use these medications in the first place because, as I mentioned, NSAIDs also can stress the mitochondria.
This be a good time for an Epsom salts bath?
This would be a perfect time for an Epsom salt bath, right? Because Epsom salts are magnesium sulfate, which, first of all, the magnesium, so many of us are deficient or insufficient in magnesium, helps us stay calm and relax. And the sulfate in the magnesium sulfate, the Epsom salts, will enhance our own body's ability to produce glutathione. So that's amazing. I love Epsom salt baths when kids are sick, when kids have an asthma flare, when kids are taking medications that need to go through the liver, and certainly, around the time of vaccines for sure.
Yeah, I think they're really helpful when we're having difficulty with insomnia, when we're having difficulty with anxiety. I look at so many young people stressed with their social anxiety that Epsom salts are really very helpful. And I know in our family, we use that for everybody in the family. We all love our Epsom salts baths. We were going to, remodel our bathroom, and the contractor wanted me to get rid of the bathtub and just put in a shower. Like, "No, no, no, I love my Epsom salt baths. I'm not giving that up."
Yeah, that Epsom salt baths are so amazing. Children, even infants and toddlers can have Epsom salt baths. You just put a little less in there.
Okay, let's talk about mindset, because and I talk about mindset a lot with my adult practice, that healing begins first in the mind. What's your perspective on all of this?
You know, absolutely. What's fascinating about mindset, I mean, in conventional medicine, we've separated our body into different systems. And the mind has been placed over here, separate from our body, which does a huge disservice to, as you said, is really, I think, the critical piece in healing that most people and practitioners are missing, or maybe paying some lip service to, but not really, putting their money where their mouth is, right? Not really, really embracing it as equally or even more important a medicine as what you can take, by mouth. And so, we know that, psychological stress by itself can alter our gut microbiome. We know that our gut microbiome and its status affects how we manage psychological stress. And the way the gut brain and the brain communicate in this way is via the vagus nerve, which many of you listeners are familiar with. Just as a side note, 80% of that communication occurs from our brain to our gut, not from our gut to our brain. So we have to think, well, who is the most important to support here? The function of our vagus nerve. When our vagus nerve is functioning optimally and our what's called our parasympathetic nervous system, our rest, digest, and heal part of our autonomic nervous system is in really good balance. And in good balance with that sympathetic fight or flight part of our nervous system, we have something called optimal heart rate variability. And many, many, many studies have looked at, optimal heart rate variability as one of the most important biomarkers for predictors of, health or disease. And so when we optimize our heart rate variability, we are setting the stage in our children to have that foundation to always get back to health, to always know how to recover no matter what's going on. And with improving heart rate variability, improving your mindset, improving vagal tone, almost everything you do to improve your vagal tone is 100% free. It takes your time, right? But it doesn't cost anything to learn how to belly breathe and diaphragmatic breathe in the right way. It doesn't cost any money to have a mindful moment and do a five senses meditation.
Hang on, what's a 5 senses meditation?
Oh, I love the five senses meditation. This is something that I talk with my kids and my patients about. And I call it stop, look, and listen, because all kids, when they first learn to cross the street, they learn, okay, they just stop, look around for cars, listen, and then they can go. And so it's taking that mindful moment. And when we stop, we give ourselves permission to stop whatever we're doing in this moment, whether we're walking on our way to school or doing our homework and getting stressed about it. We stop and give ourselves permission to take this mindful moment. And then we look, and the looking means using all of your five senses to notice what you notice. And it's first really very helpful to close your eyes because our visual input is the strongest, what we absorb and takes over our other senses. So you close your eyes and you first notice what you're hearing. And you might notice in that moment that you hear a bird chirp that you hadn't heard before, or you really notice the sounds of the cars in the highway just down the street, or you really notice, wow, I hear my neighbor mowing the lawn and I hadn't even noticed that before. And then we move on to our taste and we notice, what do you taste in your mouth? Now I can taste the minty toothpaste that I just brushed my teeth with. Or, oh, maybe I didn't brush my teeth. I can taste, that little piece of bacon that I chomped on at breakfast. Then we notice what we're feeling on our skin. Do you feel the wind blowing the hair on the back of your neck, or maybe the weight of the backpack on your shoulders? Then we notice finally hearing to smell. I miss smell. So then what do we notice that we're smelling, right? Now do you notice the fresh cut grass, that your neighbor just cut? Or do you notice the smell of the smoke coming from your neighbor's chimney on a cold, brisk morning? Finally, we open our eyes and we notice what we see. And when you do that, if your eyes have been closed this entire time, the world seems just a little brighter and you will notice colors you haven't noticed before. You'll notice maybe the little, hummingbird nest that you hadn't seen before. Fascinating what you can see when you allow your other senses first to take over. And then the listen part of the stop, look, and listen is now listening to how your body and your brain feel in that moment to just sit and ingrain that positive moment because we need to sit with our positivity a lot longer than negativity because our brain tends to stick to the negative, right? And so that takes maybe 5 minutes of your time, and it's such an important for kids to be able to stop and regulate and listen to their bodies. That is one of the keys to success into adulthood. And so learning that is so powerful.
That is wonderful, and that could be actually a very interesting family activity, that the family could do that together in the evening as part of story time with your kids, to stop and have a meditative experience, whether it's a breathing exercise or this beautiful sensory exercise you just guided us through. Elisa, I could talk for hours with you. It always gives me like so much joy. I have so much insight. And, I'm still want to come have a kimchi with you. It's
Yes.
been much too long since we've been able to share kimchi together. What is the one key message that you invite all the parents and grandparents, aunts and uncles to take from our conversation?
I would say that the key message that I want parents, grandparents, practitioners to walk away from is that no matter what stage of health your child is in right now, or no matter what stage of health you're in and you're worried that your child is going to head that same way, it is never too late to shift how your child's brain, immune system, and gut is working for them. We have the power, your kids have the power to change their epigenetic futures by how they live and how they breathe and how they think. And so this is a message of power because I know that many listening have been suffering with autoimmunity or know a family member who's been suffering with autoimmunity for a very, very long time. And you're here listening because you don't want that to happen to your children. And nothing is set in stone. And even if your kids already have an autoimmune concern cropping up, it is never too late. We can always get your kids back to a much healthier, vibrant place.
That is wonderful. And I certainly endorse and support that. There's always things that we can be doing to make our circumstances better for ourselves and the people that we love. Elisa, where do people find you?
So the best place to find me is going to be on my blog site. That's healthykidshappykids.com, where I have blogs and if you sign up for my newsletter, I send out information periodically. Promise I don't 10 out of 10. And then also on Instagram. So if you follow Terry on Instagram, just hop on over to healthykids_happykids. And that's where you'll find me and some of my latest information.
Okay, one more time, slowly for people again.
It is healthykids_happykids is my Instagram username. And my website is healthykidshappykids.com.
Okay, this has been wonderful. Now, much love to you and your family.
Yes, you too, Terry. Thanks so much for having me.
Thank you for tuning in to Doctor Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Doctor Talks. Real talks from real doctors on the issues that matter to you most.